Hi, my name is Jessica, and this is my inserting a Foley catheter skills video. First, I would gather all my supplies. I have my cath kit, my washcloths, my non-sterile gloves, my hand sanitizer, my model here, which is my patient. Alright, so I would gather my supplies. I would go to my patient's room. I would knock on their door. I would shut their door for privacy. I would then hand hygiene. Alright, I would go in and introduce myself to the patient. I would say, hi, my name is Jessica. I am here to do a Foley catheter for you today. I would ask if they had any questions for me. Alright, I would ask them for their name and date of birth on their ID band on their arm. Can you tell me your name and date of birth? Okay, thank you. I would, after confirmation, I would get my gloves on. Alright, I then, Miss Jones, I'm going to raise the bed up, okay? Alright, so I'm going to raise the bed up. Alright, Miss Jones, I'm going to put your head down here, okay, to get you in the correct position. Alright, I put their head down. Alright, Miss Jones, to get you into the correct position, I need you to bend your legs up, okay, and then I need you to open your legs outward, okay, great. I'm going to uncover you here, okay, and I'm going to clean you here with non-rinse soap. Alright, so I'm going to get my washcloth. Alright, Miss Jones, I'm going to touch you here, okay? Alright, I'm going to clean the outside. I'm going to flip my washcloth to a new area, clean the side towards me. To another clean area, down the middle. I'm going to toss that. Alright, Miss Jones, I'm just going to dry you now, okay? Same thing, dry from furthest away towards me. And another corner here. Alright, down the middle. Okay, Miss Jones, I'm now going to inspect your peri area here. Alright, I located the urinary meatus. There's no swelling, no redness, no drainage, anything of that nature to be concerning. Alright, Miss Jones, I'm now going to get my supplies together here. So I'm going to get rid of my non-sterile gloves. I'm going to throw them in the trash. Alright, I'm going to get my catheter kit out here. Alright, in the real world this would be shut. Okay, and I would inspect it, make sure it was closed before opening. Alright, so I'm going to open this up here. I'm going to take my kit out. Okay, I'm going to put my kit down here. In the real world that would be tighter than that, but alright, I'm going to take my bag here, make a trash can. Alright, Miss Jones, I'm going to stick this trash can here beside you. Okay, during the procedure, try not to move because this is a sterile field, okay? I'm going to move my hand sanitizer so I don't break sterility. Alright, I'm going to open my kit here now. I'm going to open away from me, and out, and out, and the last corner out. Okay. Alright, I'm now going to take my sterile gloves out. Okay, I'm going to open open them up. Make sure they're facing the right way. All right, I'm going to put these down. I'm going to don my sterile gloves. Okay. Putting my dominant hand on in first. Pulling down on the cuff. Okay, my cuff is on. Alright, I'm going to put my other glove on now. Sweeping underneath here. My thumb out. Put my other glove in. Alright, pulling it the whole way down. And nothing is rolled up my wrist. I'm going to toss my barrier into my trash can. Okay. Alright, Miss Smith, I am now going to place a barrier underneath your hips. Okay, I'm going to grab it here. Get the barrier out. I'm going to put the shiny side down. Alright, Miss Jones, lift your hips up for me. Okay, great. Alright, I'm also going to put a barrier on top. I'm going to grab it here. Okay. The drape, rather. Alright, now mine has been ripped. In the real world it wouldn't be ripped. Alright, placing it over you now here. Okay, great. Alright, Miss Jones, I'm just going to set up my equipment here, okay? Alright, I'm going to move my sterile field here. That way my equipment is closer. Okay, I'm going to take my tray and move it side by side. Alright, I'm going to get my alcohol swabs, rip these open, put the swabs in the tray, put that in the trash. I am then going to open up my lube, put my lube in the tray, throw that in the trash. Alright, I then am going to get my catheter out. I'm going to adjust this here. So that way when I insert, it's not going to be pulling. Alright, I'm going to take the sleeve off, making sure that my catheter does not touch anything. I'm going to throw the sleeve in the trash. Alright, I'm going to put the tip here into my lube. Okay, I am going to take my sterile water and hook it to my catheter. Okay. Alright, Miss Jones, I am going to proceed to put your catheter in, okay? Alright, so my left hand is now going to be my dirty hand. You're going to feel me touch you here, okay? Alright. Alright, and I have located the meatus again. Alright, I'm going to clean you now, okay? It's going to feel a little cold. Alright, so I'm going to do away from me, toss, towards me, toss, down the middle, toss. Alright, Miss Jones, I want you to take a deep breath for me, okay? Alright, and on the exhale, I'm going to insert the catheter. Okay. Okay, once I got enough coverage and I have urine flow feedback, I am going to proceed with another 2 inches. Okay, I then am going to hold the catheter here up at the meatus, and I am going to insert all of my sterile water to inflate the balloon. Okay, gonna pull, make sure that I'm in there good. Okay, I'm going to disconnect my sterile water tubing. Alright, Miss Jones, I'm just going to clean you up here a little bit, okay? I'm going to use your drape, okay? So I'm going to rip my drape and clean my patient up. I'm going to toss this. Alright, I can now move my catheter bag, I should say, my catheter bag. Alright, I can then dispose of all of my equipment here that's left. So all this would go in the trash. Alright, all that's going in the trash. Okay, and then I am going to I'm going to get rid of these sterile gloves. Throw them in the trash. I'm going to hand hygiene. Alright, I'm then going to attach Mrs. Jones. I have a stat lock here, which goes on your leg, okay? That keeps the catheter in place, so that way it doesn't get tugged on or, you know, susceptible to being dislodged in any way. Alright, so few things here for you to note that we want this bag here, the drainage bag, to be below your bladder. Okay, also you want no kinks or anything in the tubing. All right, and also you want to make sure that we are cleaning your peri area very well, that way you don't get a UTI. Okay, Mrs. Jones, is there anything else that I can do, or do you have any questions for me? All right, I'm going to put you, lower you, your bed down, that way you aren't a safety risk here, okay? Do you want your head up? I put her head up if she wants her head up. Alright, I would give my patient then her call bell. Alright, I would hand sanitize, I would document. I would document after I exit the room, and that'd be the end of the skill.